Did you see the match last night?
I saw most of it, and I've got to say, just like the rest of the country, I was just absolutely thrilled to see what Emma had done. I mean, what a phenomenal performance, but what also just a huge inspiration to all of us.
Wasn't it extraordinary, not to extend this? I thought the eloquence of the two young women afterwards and their graciousness to each other should be a lesson to politics, shouldn't it?
It's a lesson to us all. I mean, to go through that, and both with that desire to win, but whatever the result, how they sort of come together, they embrace each other afterwards. I think there's lessons there for all of us.
All right. Well, let's talk about the hostilities. Opened this morning with an investigation by a newspaper into your colleague Priti Patel, who it is alleged has broken the lobbying rules again. Is she becoming a liability to your government?
No, not at all. I mean, I've done that job, being Home Secretary. I know just how difficult a job it is, and I think she's been doing really well over the last couple of years, and it certainly is one of the most challenging jobs in government. And I remember when I had that job, when you're waking up almost every day and finding there's something going on that is something to do with the Home Office, and it's a big job, and I think she's doing a good job.
Yeah, but she could probably do without, not to extend the tennis metaphor too much, without yet more unforced errors by meeting people she oughtn't to be meeting.
Look, I haven't seen that report, so I'm not sure what you're referring to. But look, I think that, as I say, it's a really tough job, and she's doing really well. There's so many things that she's already done with the legislation that's been put forward. But I also know, as Home Secretary, you also do a huge amount that never gets into the public eye, because it's not something you can ever talk about publicly. And I think it's obvious to me, having done that job, that she's carrying out that part of the work here, the stuff that's never in the public, incredibly well.
OK, let's talk about how you're doing your job. Can we
Please
expect that there will be no need for PCR tests when we travel in the near future?
Well, Trevor, if I may, just sort of set out our plans for the future, and I will respond to that question as well. Now that we're entering autumn and winter, it's something that COVID and other viruses usually like. The Prime Minister this week will be setting out our plans to manage COVID over the coming few months. And in that, we'll be making it clear that, first of all, our vaccine program is working. It's been phenomenally successful. We now got over 80% of people over the age of 16 double vaccinated, some 90% at least having one jab. And it's been fantastic in reducing the rate of hospitalization, something we all wanted to see. Alongside that, it's been complemented by fantastic new treatments, a juggernaut of a testing regime, and also our surveillance program, probably one of the best in the world. So we've got a huge number of defences. Of course, we still want to remain very cautious. And there are some things that, when it comes to travel, for example, there are some rules that are going to have to remain in place. But the PCR test that's required upon your return to UK from certain countries, look, I want to try and get rid of that as soon as I possibly can. I'm not going to make that decision right now, but I've already asked officials that the moment we can, let's get rid of these kind of intrusions, the cost that generates for families, particularly families just trying to go out on holiday. We shouldn't be keeping anything like that in place for a second longer than is absolutely necessary. OK, so the PCR tests gone ASAP. What about vaccines for 12 to 15-year-olds? Also ASAP? Well, I think your viewers will know that we have been looking at that. I'm not in a position to make a final decision on it. I've received advice a week or so ago from the JCVI, our committee of experts. Their advice was that I should ask the chief medical officers of the UK, the 4 chief officers in the UK, to take a look at not just the health aspects of vaccination, but whether there were any broader reasons that it might be in the welfare of children. And that's what I've done. And they need to be given the time to look at this, and I'll wait to see what they have to say.
Have they when will they give you their advice?
I'm not going to push them. They need to take their time. It's independent advice as it should be. They need to take their time. I don't think they'll be taking that much longer. But in the meantime, I have asked the department to work with schools, the school vaccination teams, to start preparing, just in case we have a situation where their advice is to recommend it, and that if the government accepts that, then I just want to be able to go ahead with it.
Isn't this a little bit of a relaxed approach to something that is really rather urgent? We're already seeing cases spiking in Scotland after schools opened there a few weeks ago. And actually, you're saying that we're focusing on the vaccine. You said that this morning as a first line of defence. Yeah. But actually, we're seeing warning signs from elsewhere in the world, Israel, for example, that the effectiveness of the vaccine might be waning. Are you being a bit complacent about the situation?
No, not at all. I think let's deal with the vaccinations. They're both potentially for children, but also potentially boosters, and I'll come on to that. For vaccinating children, if we are to make such a decision, it has to be led by the experts. We have to listen to expert opinion. Now, as I've said, the JCVI have already looked at this. They made a recommendation to me to pass it, to have another look from a different aspect from other medical experts, and that's the right way to do it. And I think it's fair to say that adults are going to be naturally more hesitant about vaccinating their children than they were about vaccinating themselves. That's perfectly understandable. That's true the world over. So if we're going to do this, it has to be done properly, and it must not be rushed.
But it's going to be done soon.
Well, hopefully soon. And as I say, in anticipation of the final advice, I want to be ready. And that's why the system is getting ready for this. But Can I also just turn to boosters? Because you talked about waning immunity. We now, of course, do know more about this virus and vaccination than we ever knew before. There is evidence of waning immunity, particularly in older people, more vulnerable people. And we're already taking action on that. So, for example, just a week ago, I announced that those people that are immunosuppressed, that should get a third jab, not as part of their primary treatment. That has already started. And in terms of a general booster program, we have asked the JCVI to look into this. They gave me interim advice a month or so ago where they supported this, but they said they wanted to do some further work. We've given them the time to do that work, but I believe we will be able to start our booster program subject to their final advice on schedule this month.
Good. OK, now, when the Prime Minister speaks to us this week about his programme for the autumn and winter, will that include vaccine passports of the kind that the Scots have already decided they will have? That is to say, when I go clubbing, will I need to have a vaccine passport?
Well, Trevor, I know you like clubbing. I know why this is so important to you. So let me answer your question. That, look, I think if we went down the road of vaccine passports or vaccine certification, as it's sometimes called, that's a big decision for any government to make. We have been looking at that. We've been open about that. Instinctively, I don't like the idea at all of people having to, let's say, present papers to do basic things. So if we do that, it has to be something that is looked at very carefully and something that we believe that has to be done with no alternative. With the vaccination rates. With the vaccination rates rising, for example, with 16 and 17-year-olds, we only started just last month. Now over 50% of 16 and 17-year-olds are already vaccinated. I think we need to take that into account and make a final decision, but I hope we can avoid it.
Well, you say you hope you can avoid it, but this is a precautionary issue. I mean, vaccine passports are proposed because we need to protect people, well, coming back to the clubs, people like myself and Michael Gove, who are in and out of clubs every week. We need to protect people. Are you ruling it out, or is it still on the table?
Look, I'm not here today to rule that out. We haven't made a final decision as a government. We have been looking at it. We've been very open about that. But as I've said, that I think if we did something like that, it has to be supported by the evidence. And it has to be something that is absolutely necessary with no alternative. So, as I say, I hope we can avoid it.
What is the evidence telling you about the big danger this winter? Is it more COVID Delta variant? Is it a new variant? Or is it conventional flu? What is the evidence telling you that we need to be most concerned about?
Well, winter, autumn, it's not just COVID that likes that part of the year, it's other viruses too. And you've just mentioned another really important thing that we've got to prepare for, and that is flu. I've already mentioned the preparations for boosters, and I think that's going to be an important part of our defence. But when it comes to flu, what we've been planning in the past few weeks is the biggest flu vaccination programme this country has ever seen. Why am I concerned about that? Because last year we didn't have much flu because of all the other controls that were in place, and that means just is a lot less immunity around to flu than normal, and we know that in some years, in a bad flu year, just how terrible it can be. So alongside our continuing COVID vaccine program, we're going to have our biggest ever flu program, and I would say to those people listening that certainly those that are over 50, getting your flu jab is going to be as important as having your COVID jab.
All right, let's talk about the other big announcement of last week when you broke your manifesto pledge in order to introduce a new health and social care levy, a new tax. You've asked us to believe that the 12 billion that you're going to raise each year for the next 3 years will eventually go into social care. When you're in banking, would you have said to a customer, I've just raised the interest rate on your loan, but don't worry, trust me, would you give me your mortgage to look after? Why would we trust what you say after you've broken not one, but 2 manifesto pledges?
Well, first, can I just turn to the manifesto pledges, since you started with that? You're right. We made a commitment that we wouldn't raise certain taxes, and that included national insurance. Now, we had an option. Given the global pandemic, we had an option. We could doggedly sort of stick to that manifesto commitment and say, look, you know what? We know there's a global pandemic. We know that there's unprecedented strain on our health and social care systems. They need more support, but we're going to ignore that because we've got a manifesto commitment. Or we could have said, we're going to do the responsible thing, and the circumstances have changed. And I think it's no exaggeration to say that no one had predicted this pandemic, and that it has changed, so many things. And we could respond to that in a responsible way. And that's what we've done. And I wasn't prepared to see, as the health secretary, for example, with the NHS, with the growth that we've been seeing in the waiting list, I wasn't prepared to see that waiting list being any higher than it needs to be. I want that waiting list to be tackled. And the way to do it is to make sure that the resources are there and they're also making the right reforms.
Aha. Now, look, that's a great justification. But you could be, if you're still health secretary a year from now, and you might want to tell me something about the reshuffle speculation if you want, you could be coming on here next year and giving me another great and smooth reason for why you've changed your mind. Let me ask you if you would give us a commitment. You're saying that you'll switch the money into social care when the COVID emergency allows and waiting lists allow you to get to somewhere. Set a level. Is that going to happen when waiting lists get back to pre-COVID level? Let's say, for example, the level of 2010 when Tories came into government of 2.5 million. Would you say that's when social care gets the money?
What I'll say, Trevor, is that first of all, of the announcement, the money that we said that will be raised, the total 36 billion, some 5.4 billion of that will be going to social care, no matter what happens. That's going to be going into social care to support the new cap, to support a more generous means-tested system, to give local councils more support, more workplace training. So that's going to go into social care. Over time, over the sort of those 3 years, the NHS would have made maximum use, huge use in tackling the waiting list with the money that it will be getting. But also that cap that we've announced, the £86,000 cap on lifetime costs, that only sort of starts to bite in later years, beyond the 3 years. And that's why this levy, I'm certain, will be able to cover that cost and those costs in the years beyond the next parliamentary period.
There's a timing thing here, though. Let me tell you what they're saying in local government. They're saying that when you start spending the money on social care, which is 2023, The money that you've raised from this new tax will still be going into the NHS. And you know who's going to have to fill the gap in those 3 years? Local government, through raising the council tax. And what you will then do is say, we raised the tax, but local government, spendthrift, they're not doing their part. You are going to dump this on local councils, aren't you?
No, not at all. I mean, already today, spending on adult social care, some in normal times around £20 billion a year. That's a combination of funding from central government and locally raised funds. What we've announced this week is a top-up on that to provide, as I say, the more workplace training, this new system of a cap and better means testing. So it's a top-up of that. It will remain a combination of funds, and each year it will be determined based on need. But the changes that we've announced today will make it a stronger system, and local authorities will continue to play a hugely important role in that.
OK. Look, a quick question on universal credit, and you can do this in yes and no. Are you going to cut universal credit by £20 a week?
We're going to end the temporary increase in universal credit.
So the answer, yes. That cut, you're not budging on that at all?
The increase, which was temporary, will be ended as planned at the end of this month.
It's been reported this weekend that the Prime Minister reckons that he wants to stay in Downing Street for another decade. Well, obviously, the electorate's going to decide that, but they're going to want to know why he wants to stay there. And there's a curious thing here. You spend trillions of public money. You intrude on individual freedom down to telling us what we can and cannot wear on our faces. And you boast about defending the most socialist health system in Europe. What exactly is conservative about the Tories right now?
Well, if you look at, you talked about the intrusion on freedom, and that, you're right to raise that we should never intrude on people's freedom unless there was a really, really good reason to do so. What we've seen in the last couple of years is the government respond to a global emergency, respond with the most successful vaccination program the world has ever seen, and help us get through this very difficult period, including having to break a manifesto promise to make sure that we show people just how responsible and serious this government is about meeting the people's challenges. We've done that. Even the package we've talked about, but we've done that in a responsible way by being honest and raising a tax instead of borrowing and mortgaging the future of the next generation. That's very conservative too. But we are always looking to make sure that as a country that we support businesses, we support the economy so it can continue to grow. And there's no doubt as we start to see that growth now, we can create the opportunities that everyone would expect a Conservative government to do so. All right.
Well, look, let me ask you a question which essentially is about whether you don't come back on here and give me some more reasons for why you're not really a Tory. Will you commit to no more tax rises in this Parliament?
Look, I'm not Chancellor anymore. If you get the Chancellor on your show, you can ask him about tax questions. What I can tell you, as a Conservative and as a proud member of a Conservative government, we should always be trying to keep taxes as low as we possibly can and making sure that we recognise that when you have tax, any type of tax, you're taking away hard-working people's money and every single penny should be spent wisely.
All right, let me put this another way then. Deal between you, Sajid Javid, and me, Trevor Phillips. If somebody comes forward, Chancellor or Prime Minister, with a proposal for more tax rises in this Parliament, will you, Sajid Javid, oppose those tax rises?
I think we should be, if we have to spend more somewhere else, I think that we should always be trying first to see where we can make savings to pay for that, not extra tax rises. And tax rises should always be the last resort. It's been right to do it on this occasion, but we should always try to avoid it.